My name is Adam Gallegos. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. Today we're going to be going over endotracheal drug administration. First off, I want to make sure we have our BSI on, gloves, eyewear. You can also verbalize this. To start, we're going to prep our equipment. We're going to check and recheck our medication that we're going to give. We're going to check the clarity, the expiration date. We're giving it to the correct patient. Again, make sure that it's the correct medication. Make sure that it's the correct dose, we're giving it the correct route, and that we document the correct time that we gave it. We're going to prep the medication at this point. There's two ways that we can do this. We have a pre-filled syringe and just use the manufacturer's instructions on how to assemble this. And then if it's a multi-dose medication that we have to draw up, we're going to withdraw the medication with a needle and syringe using a sterile technique. And we want to make sure that we give a minimum of 3 to 5 milliliters of medication and saline combined. Next, we're going to prep the patient. We're going to ask any bystanders if the patient has any allergies to any medications or adverse reactions. We're going to explain to any bystanders the procedure that we're going to be doing. And then right before we give the medication, we're going to give the patient two to three breaths to oxygenate the patient, and now we're ready to administer. First, we're going to ventilate the patient 2 to 3 times to pre-oxygenate. Then we're going to disconnect the BVM and quickly administer the medication. Now, if possible, if you can, thread a soft suction catheter or an NG tube down the ET tube until resistance is met. You could administer the medication through that catheter and then withdraw the catheter. So we're going to reconnect the BVM. We're going to ventilate the patient 12 to 20 breaths per minute. And then we need to monitor the patient. We need to monitor the ventilatory rate and the depth, monitor the vital signs, monitor any adverse reactions to the medications, and monitor for any desired effects from the medication. And this concludes the endotracheal medication administration scenario.